Hi everyone. Today we will discuss about the new drug update for INI-CET exam, and I will explain all the drugs, their mechanism and their uses with the help of very easy mnemonics so you can easily remember these drugs. So let us begin. So the drugs for the neurology and for the central nervous system, suzetrigine. So suzetrigine acts on the NAV 1.8 voltage gated sodium channel, and these are useful for the non-opioid analgesic acute pain. So these you can remember that Susan was NAV and she was triggered with the pain. Suzetrigine. So trizine is for the trigger of a pain, and Susan was NAV. So it acts on the NAV sodium channel. So this is how you can remember this suzetrigine. Then lesmeditan. So this is a 5-HT1F agonist. So unlike the triptan, 5-HT1B1D, which causes vasoconstriction, so this triptan you cannot use in the treatment of those patients who are having a myocardial infarction or coronary artery disease. Lesmeditan is safe to use in those patients with the history of the coronary artery disease and myocardial infarctions. So lesmeditan is used for the migraine. So MI stands for the migraine who are having a MI or coronary artery disease. So lesmeditan is safe to use in this type of the patients. Now coming to the drugs for the Parkinson's disease and for the movement disorders, pimavanserin is a 5-HT2A inverse agonist. So SER stands for the serotonin, HT stands for serotonin. It acts on the serotonin receptor. V stands for 5 and it is a inverse agonist. So IN stands for the inverse agonist. So pimavanserin is a 5-HT2A inverse agonist, and this is useful for the levodopa induced psychosis. So when the Parkinson's patients take levodopa on long term, then the levodopa will result in psychosis like symptom. To treat this psychosis symptom, we have to give antipsychotic drug. But if we give antipsychotic drug, then it can worsen the motor symptoms. So when you want to treat levodopa induced psychosis without worsening the motor symptoms, you can give pimavanserin. So PIM in pimavanserin stands for Parkinson induced mood abnormalities. So this is how you can remember this drug. Now for the treatment of the on and off phenomenon, COMT inhibitor that include capon drugs, opicapone and entacapone. Then MAO inhibitors which include cefenamide and salazilline. So these are the SS drugs for MAO inhibitors. Then adenosine A2A antagonist which include istradifylline. In this you can see the ADE, and in adenosine there is a ADE. So adenosine antagonist is istradifylline. Valbenazine and deutetrabenazine. So these drugs are the VMAT2 inhibitor, vesicular monoamine transport type 2 inhibitor, and these will decrease the presynaptic dopamine release, and these are useful for the treatment of the tardive dyskinesia, which is a hyperkinetic movement disorder. So V stands for V. Valbenazine is for VMAT. So this is how you can remember valbenazine and deutetrabenazine for the treatment of the tardive dyskinesia. Now ALS, amyotrophic lateral sclerosis. The drugs are tofersen, which is an antisense oligonucleotide and which acts on the SOD, superoxide dismutase mRNA mutation. So sen means antisense. Tofersen is an antisense oligonucleotide. Another drug is riluzole, which is a NMDA antagonist. Other drug is a edaravone, which is a free radical scavenger. So these you can remember as a RA. So RA stands for radical scavenger. So these drugs are useful for the all the types of the upper motor neuron and lower motor neuron. So in ALS of all type UMN and LMN, these drugs are useful. Now coming to the drugs for the Alzheimer's disease, so that include aducanumab. So this is the monoclonal antibody against the beta amyloid plaques. So these you can remember for Alzheimer, A stands for aducanumab, and again this A stands for amyloid plaques. So these acts against the amyloid plaques. Now coming to the drugs for the epilepsy. So these include tiagabine, which is a GAT1 inhibitor. So these will increase the GABA level in the cleft. Now this GABA is an inhibitory neurotransmitter. So these are increased. So that will calm the brain. So these you can remember that it will increase the GABA. It is having a GAB in its spelling and it is a gate inhibitor. So GAT, it starts from the T. So it's a transport inhibitor. Now another drug is a rufinamide. So this drug is a MGLU-R5 inhibitor. So that is metabotropic glutamate R5 inhibitor which acts on the glutamate receptor. So glutamate is an excitatory neurotransmitter and rufinamide is going to decrease the level of the excitatory neurotransmitter and that is how it will calm the patient. Now another drug is a lacosamide. Other drugs in the epilepsy, they acts on the fast sodium channel inactivation. Lacosamide acts on the slow sodium channel inactivation. Lacosamide is also CRMP2 inhibitor. So lacosamide is used in the epilepsy and lacosamide, so it is having S, so it is a slow sodium channel inactivator. So this way you can remember the drugs. So if you like the video about the new drug updates for the INI-CET exam, subscribe my channel and follow for more pharmacology related videos. Thank you.